All right, so we're going to do a details analysis on, actually I haven't shared screen, let me go do that now, on this stem here. And what a detailed analysis is, or what a details analysis is one of three ways that you might like to go about understanding whatever there is to understand about a STEM. So the other two would be an ethics analysis or a stakeholder analysis, which is where you consider the situation from the perspective of each person in the STEM, and in doing so, increase the likelihood of identifying issues that you mightn't have thought of thinking about it abstractly or just from your perspective. So I have tentatively thought of a way that we might be able to more explicitly prosecute or deploy this technique in order to maximize pulling every single issue out. And I've actually stopped doing nearly exclusively, except in medical ethics stations. I don't really do ethics and stakeholder analysis as much at all anymore, particularly in STEMs this long, because it's just so much information. But what we're going to do is going to go through and Sally has very generously offered to be the hamster here to help us find everything. So rather than considering the STEM as the whole, I'm just going to delete, and then Sally, you just tell me what the issue is regarding each bit. And it's okay to get it wrong, and we'll just keep going back and forth until you got it. So I know we've already just discussed the first two, but we'll repeat for the sake of the recording. What is the issue? Well, actually, I suppose where we started was the first word, you. There's no information there. There's no issue. So we move on. You have, again, there's nothing really there. You have an, really, there's nothing you can get there. But here we go, 18-year-old. Now let's assume, I won't put the word friend there, but we assume that we know that the word friend is coming. What is the issue, Sally, regarding the fact that they're 18 versus, I don't know, 40 or 6?
So this person is at a stage in their life where they have the ability to make decisions for themselves, but those decisions aren't but they are particularly vulnerable in the sense that those decisions aren't always the best informed, or
it's this age that's at the cusp of,
the
a year
cusp
ago
of
they were a kid.
adulthood. Yeah.
Right. So, they're being treated for the very first time, they're being treated as an adult, and they can go out and make decisions that can get them in really, trouble, and that can frame and have consequences for the rest of their life. But in many cases, not all, but many 18-year-olds don't have the best acumen or life experience to be able to negotiate those situations in the way that's in their best interest. So it's a tumultuous time of life, and one where particularly you'll find out in a moment that your friend is female. I guess for everyone, but it seems to me in particular the teenage years for a female is one about reorienting her understanding of the world and her place in it, and her self-image. And so yeah, it's a delicate time. All right, good. Moving on. Now, what's the issue here with this new bit of information?
So friend, the issue is that I have a personal connection with this person, which entails some kind of responsibility.
That's right. Very good. Okay, so whose mother died? How about now?
So the issue is that their mother, or someone who could potentially guide them through this particularly tumultuous time in their life, is no longer here.
Very good. Yeah. And what else? There's another thing regarding the death of any. That's you actually. I should have done this. I suppose the implication would be it doesn't make sense until the mother died, but you have correctly identified that the point there was that the fact that it was a mother that died rather than anyone else. Yes, that's a very special relationship. But let's have a look now about the fact that her mother now is dead. What might that entail for this person? So it always helps whenever you get stuck in an interview station to imagine yourself in the situation. God forbid, but how would you be if your mother died?
I'd be quite devastated. I'd be sad.
There's
Yeah.
the issue, right? So
Yeah.
it's a destabilizing time at a time in your life where you haven't got foundation, and now you don't have the parental support to help you through that situation. Great.
Yep.
Here we go.
Yeah.
Right now, what's the issue here? Versus, say, her mother dying when she was 2.
So this has happened quite some time ago. And so I guess it's assumed that whatever emotions were felt at the time might not be as intense as they are now.
That is true. I agree with you.
Um,
I still think though, given the fact that she would have been 14 at the time,
yeah.
4 years ago, look, it's long enough that it wasn't yesterday and it's kind of the wounds aren't fresh, but it's still not long enough that it hasn't had a major impact in your life. So I think the fact that it's relatively recent, especially given that particular time for a young woman, 14 to 18, is an extremely delicate and sensitive time. So it's unlikely that she is through the storm, so to speak. All right, moving on. How about this? What's the relevance or what's the issue with respect that it was cancer rather than, I don't know, anything else, natural causes or
So she died from a medically related cause.
yeah.
She, given that it was cancer and there's a lot of treatment involved, she might have suffered for a period before she died.
Yeah. So it could have been a
And
traumatic passing.
yeah, it would have been traumatic, yeah, for the friend.
And also
Yeah.
seeing, there was probably a period of decline. Also, depending on some people, like there might have been a battle with cancer, trying this idea of, we're gonna get through this, and then you don't. So it could have been very jarring, and it's possible that, depending on how she managed it, that there wasn't closure there. All right. For the sake of time, we'll add in the 13, the 15 with the fact that the two youngers. So she's got two young brothers. What's the issue there?
So she has family who might have also been who were also impacted by the mother's death, and these younger brothers are adolescents, so they're quite young, and possibly dependent on her at this stage in their life.
Yeah, I agree with all that. To finesse it a bit further,
Yeah,
the ages in particular. So the youngest would have been 9, and the eldest would have been 11 at
yeah,
the time. Like that's
yeah.
again for a boy, a very she's not moving necessarily fully into being a man yet. They would have been very dependent. Would have been a close relationship with their mother. What you're getting here is a picture of a family that would be extremely destabilized based on the timing, and that perhaps she hasn't had the space to be able to process it herself because she might have had to have assumed a mother role because she's the only female in this family now. And they might have looked to her and being the oldest, perhaps for some kind of guidance, which means that she's in really quite a precarious situation here. Okay, moving on. Very good. What's the issue here?
The issue here is my friend's health and potentially the issue of substance abuse.
Yes.
Mm,
Let's start
yeah.
with the recently. Remember, because we're going word for word. I mean, it's hard for me to.
Yep.
It's hard for me to do it like this, because then we don't know what she's recently started. But if you knew that it was drinking, what's the emphasis or what's the point about the fact that it's recent?
So there might have been something that has happened in her life recently that's caused her to something else might have happened in her life recently.
Yeah. She's
That's
already got a
happened. Yeah.
skinny foundation in the sense that, she's, hasn't spent these years building, developing herself. Maybe she has in another sense, but, she's perhaps easily knocked over by something else or something she wouldn't have been in a different circumstance because of the peculiar nature, the difficult nature of what she's going through. Also, the fact that it's recent means that whatever the precipitating cause is might still be fresh enough to be addressed with her and have her not behave in these ways. It's another thing as well. All right. Um, and how about the fact that it's not just drinking, but drinking heavily now?
So whatever has happened, uh, is quite like must be quite severe, or that and the fact that she is already in a relatively destabilized position yes.
Yeah, and to add a few
Yeah,
more.
yeah,
So the fact that it's heavily says there's a lack of balance or a lack of knowledge of how to drink. I mean, I wouldn't at all, but if you're going to, how to do it in a way that's appropriate and responsible. There's also the risk of what kind of people she's hanging around. If this is the case, I mean, it doesn't mean that all people that drink heavily are bad people, but maybe,
yeah,
or people maybe that aren't concerned about her. In what environments is she drinking? Is she safe? Is she blacking out? Is she being sexually promiscuous in a way that is incongruent with how she would otherwise want to be? Does that have implications regarding contraception and sexually transmitted infections? Also, the fact that the drinking is often used in situations like to numb, so it could be used to be numbing the pain previously, and she's just discovered drinking. What's the implication for her life going forward if she continues to behave like this, as far as her, career prospects, university studies, self-image, the kind of people she's going to hang around, the kind of people she might date. I'm not saying like obviously a lot of young people drink, but I think the implication here is that it's not just drinking heavily on a Saturday night kind of for fun, and that it's the fact that this is an ethical dilemma that we're dealing with, and the background kind of raises a few flags for what the nature of the drinking might be or where it's coming from. Does that make sense?
yeah.
All right, moving on. All right, is this helpful? Are you understanding that, like, the point of how each point? Yeah, okay.
Yeah, yeah. So I'm kind of thinking out loud here, but that the drinking that she practices must be unsafe, given that she's ended up in the ER. Like sorry.
No, but
That it's quite yeah, that it's quite unsafe, the drinking that she's practicing. Um, yeah,
mm. It's not just unsafe drinking. It's like, I mean, there's drinking heavily, and then you have to really be drinking like in a way that's out of control to end up in the ER.
yeah,
And then who are the people around her that kind of let her do that? Usually, at least in drinking culture, there's often particularly with 18-year-old women, there's generally friends that take care of you, look out for you, that kind of thing. That doesn't seem
yeah,
to be the case here. So it's growing in its level of concern. And then, of course, twice, which is to say she didn't learn her lesson from the first time. Yeah.
yeah.
Um,
Or the hospital might there might have been something missed the first time, like the hospital could have like educated her
yeah, there could have
on
been
how
a
to not.
psychological referral.
Yeah, yeah, yeah,
Yeah, follow up with the GP. Like, yeah. All right, good. In the interest of expediting, let me continue.
yep,
This says that perhaps she hasn't got the closest relationship with her father, or that her father hasn't created a space where she can ventilate fully the experiences she's having. In other words, it's speaking to a more compromised support system in this already tenuous and precarious situation. Okay. This bit, he's not coping well with the mother's death. So, obviously, we've lost one parent, as we discussed earlier. The other parent is no longer around to be able to stabilize that family dynamic. So we've got a family that's really in a crisis situation, right? And look, it gets worse. He's an alcoholic himself. So now we know why she started drinking. Probably she's got a drinker in the house. Probably there's alcohol in the house. And, being an alcoholic, that means he's probably not able to fully manage the family affairs, be a father figure for these people that need it. And so, yeah. All right. And then lastly, she wants your help versus anybody else. So, given the amount of detail we've just gone into about how tenuous this situation is, are you the best person to be able to negotiate the situation? It doesn't seem like she's got many other people, so maybe it does fall on you, but I would just be aware of being very cautious and delicate about how this particular one is managed. And then here, I'll give you one go. This might be a tough one, but tell me, can you see what the issue is? What are some potential issues that you can see about this dimension of the situation?
that there might be an issue with her housing situation. There might be either she doesn't have housing, or there might be something going on at home that's making her feel unsafe or uncomfortable. And so she wants to stay with me to get out of that situation.
Yep. So I agree with. So if we think of things in terms of before, during, after, in terms of before, what are the precipitating factors? Sure, maybe the house environment's unsafe. Maybe she just needs some relief. Maybe the dad's being trouble. Maybe she doesn't feel safe. Maybe he's kicked her out. Who knows? What might be some consequences of her coming and staying with you in light of the information that we've just received in the STEM about her drinking and her coping strategies and her brothers?
That there is the implication that there will be more responsibility for me, or that I could be affected.
Yeah, that's right.
Yeah,
That's good.
yeah,
You need to take care as a prospective medical practitioner. You need to be aware that your well-being and safety is also a consideration. Your autonomy, your beneficence and non-maleficence is a factor.
yeah.
Yeah, and another one that I see potentially is that we've got someone here that's quite out of balance, that's really kind of spinning out of control. But someone who has, and it's probably to her detriment, but in a sense, but the fact that she's got these younger brothers looking up to her and the dad's not in the picture means that she might be the only one in this situation that has any kind of responsibility in the household. And so there's possibly some extent to which her sense of familial obligations are regulating or stabilizing her behavior. If she then separates from that situation, both in terms of the sense of responsibility she feels to her brothers, but also any sense of accountability from the dad who doesn't know that she's drinking, and all of a sudden she's at yours, what's to stop her going absolutely wild? It's like, oh, finally relief. Now I can do whatever I want. And then she goes even harder. And also, once she's out of the situation, how are you going to get her back into the situation? There's so much there, isn't there? So there's like 20 points there. Now, listen, you don't need to get them all in order to score well. What I'm trying to draw your attention to is that there are no extraneous bits of detail or information in the STEM. There is so much there. And rather than consider the situation as a whole, close your eyes and then kind of think of it, it's easier just to take each detail as a prompt to go, okay, there, and just list them out. Because in the response, there's some theoretical, list of all possible issues in the STEM, and each one you tick off, you get a mark. So that I'm starting to find the more I teach that this is one of the most reliable ways to get high numbers of issues. And then as a result, to show the marker that you're someone that is highly observant, detail-oriented, emotionally intelligent too, and sensitive to the things that need to be considered in order for you to appropriately respond. Because they can train your response, but they can't train what you see. Does that make sense?
Yep.
All right, legend.